Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Dermatologics. I'm Stephanie Talea with Practical Dermatology magazine. The FDA has approved Jeuveau, Probotulinum Toxin A XVFS, the lead product from Evolus Incorporated, for the temporary improvement in the appearance of moderate to severe glabellar lines associated with corrugator and/or procerus muscle activity in adults. It will be available to physicians this spring. Evolus is the first company in nearly a decade to enter the fast-growing U.S. aesthetic neurotoxin market. What makes Evolus unique is our focus on delivering performance beauty products with a customer-centric approach. We are pleased that Jeuveau, the first FDA-approved neurotoxin dedicated to aesthetics and manufactured in the state-of-the-art facility using high-pure technology, says David Moatazedi, President and Chief Executive Officer of Evolus, in a statement. Dr. Ava Shamban, a board-certified dermatologist and clinical investigator, comments, "The outcomes I've seen for my clinical trial patients firsthand, combined with the comprehensive clinical data set for Jeuveau, provide a compelling new treatment option for physicians and their aesthetic patients. The Transparency Program involved a study of over 2,100 patients globally, which included 2 U.S. pivotal Phase 3 trials and a European and Canadian Phase 3 head-to-head trial versus Botox, in which all the primary and secondary endpoints were met. Importantly, there were no serious drug-related adverse events reported. The comprehensive data set generated by Evolus through the Transparency Clinical Program will give my peers the utmost level of confidence in providing Jeuveau to their patients. I look forward to incorporating Jeuveau into my aesthetic product offering." The George Washington School of Medicine and Health Sciences and the GW Medical Faculty Associates have selected Dr. Adam Friedman, Professor of Dermatology, to serve as the interim chair of the GW Department of Dermatology. He assumed the role on January 31st. Dr. Allison Ehrlich, Professor of Dermatology and the founding chair of the current Department of Dermatology at GW in 2012, has stepped down from the chair position to rejoin the clinical faculty. "I am grateful to Allison for her years of dedicated service and leadership and her success in reestablishing the Department of Dermatology and its residency program," says Dr. Jeffrey S. Ackman, Vice President for Health Affairs, Walter A. Blodorn Professor of Administrative Medicine, and the Dean of the GW School of Medicine and Health Sciences, in a news release. Dr. Friedman, who joined the clinical staff of the GW MFA and was appointed to the GW SMHS faculty on June 1, 2015, has been a leader and innovator since his arrival at GW. He also serves as the founding director of the Dermatology Residency Program, is the Director of Translational Research in the Department of Dermatology, and is the Director of the Supportive Oncodermatology Program at the GW Cancer Center. Dr. Friedman has a proven track record as a physician educator. He currently serves as the Medical Director for the Orlando Dermatology Aesthetic and Clinical Conference, Special Advisor for the Dermatology Education Foundation, Director of the Oakstone Institute's Dermatology Board Review and Dermatology for Primary Care Series. He is also Deputy Chair of the American Academy of Dermatology Poster Task Force and is the Senior Editor of the Dermatology in Review, the largest board review program in the U.S. Locally, he initiated several GW SMHS branded activities utilized by residents and medical students across the country, including Crazy Codochromes, for which he received the 2018 Innovations in Residency Training Award from the Journal of Drugs and Dermatology. Adam is a nationally recognized researcher, educator, and prolific scholar. He brings great enthusiasm and an exciting vision for the future of the department. These qualities make him the right person to fill this interim chair role, says Dr. Ackman. Dr. Friedman's research involves the investigation of nanotechnologies that allow for controlled and sustained delivery of a wide spectrum of clinically relevant molecules, with an emphasis on treating infectious diseases, accelerating wound healing, and controlling inflammation. He holds multiple patents derived from these investigations and has published more than 160 papers and 2 textbooks on his research, as well as a variety of clinical areas in dermatology with an emphasis on emerging medical therapies. He has received many awards for his teaching, research, and clinical care. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Dermatologics.